Overall, what do you see are some of the biggest misconceptions for spine surgery? I know I've had a lot of patients where even just like a knee replacement, they're like, "This isn't exactly what I thought it was," and I wasn't expecting to be in this much pain, and so on and so forth. And I guess like what do you see that are some of patients like biggest misconceptions when they're dealing with spine or neck surgery?
Yeah, I mean, I think especially as like a young guy, I see a lot of like back pain and neck pain that probably never need surgery, but they're coming to see a spine surgeon, so they're thinking maybe surgery is an option, and they walk in, they're like, I never want spine surgery, and I'm like, well, it's nice to meet you, I'm a spine surgeon. But I think that they hear that maybe it's dangerous or it doesn't work, right? Those are probably the two biggest things here, right? It's super dangerous or it doesn't work. And I think neither of those are necessarily true. It's just that, I think we've had a sort of an epidemic of a lot of people operating, a lot of people in our field operating, maybe trying to fix a problem that may not have ever really been their main issue, or may not have been able to actually treat them. So, whether or not they can have a surgery is one thing. Whether or not that surgery is going to make them better is another. So I think, you have a lot of people that underwent maybe spine surgery that didn't get particularly better. And then that news spreads like wildfire way faster than the people that have a great outcome. So, and I think that's kind of a little bit of, especially in the Tampa, Florida area, we have a lot of laser spine institute that kind of went to the wayside. And a lot of places like that were, maybe stretching indications and trying to, be a little bit more aggressive in fixing people when maybe they could have gotten better with non-operative care, maybe not, but, then I think we're kind of learning a little bit who to operate on and who not to. I mean, that's an ever evolving field, but it's probably the two biggest misconceptions is the safety of spine surgery. It just sounds dangerous, right? It sounds, and then, the efficacy, like, is surgery effective?
Right. And I remember when I was a student, one thing that I saw was for some reason, when I was in PT, I always saw like almost like a negative outcome with low back pain, low back surgeries when I was a student. And I was like, why am I like, is a surgery like not going as planned? And, later to come to find out, talk to other surgeons, like you said, like usually a lot of the time when they have an unsuccessful surgery, they go to PT, or they just like they continue to try and figure something out. And so like I was almost like I was seeing a biased sample size of the people who were probably the most loudest,
100%.
and were probably the people who were getting they were just having a positive outcome to surgery because maybe they didn't get the right surgery for them. Maybe they had a preconceived notion of like their viewpoint on pain and so on. And so for other providers who may be seeing similar things, or very young in your career, it may just be you're seeing a very skewed sample of like how successful spine surgery actually is.
Yeah, no, I think that definitely plays a role in it, because the happy ones they're happy at home, right? They're
Right.
good. They're they're living their life fine. And then the ones that didn't have as good of an outcome, you're trying everything you can to get them where they want to be. You're back in PT aggressively and trying to figure things out. And then I think probably a lot of it is expectations, which I think is probably one of the most important things for surgery. Is like, what's your like goals for the surgery, right? Like what is your goal as a patient to get out of this surgery? And if you have you have just low back pain and degenerative disc disease, and you want that to be cured, you're not a good surgical candidate, right? Because we're not great yet at correcting just isolated back pain that's a degenerative. Like, you get arthritis in your knee, you replace your knee. It does great for most people. Very successful surgery. Hips are even more successful, right? But it's much more. Those are much more simple joints to fix, versus isolating where that pathology is coming from in the low back. As you see these patients all day, every day. Is that figuring out what's their actual complaint and what's causing it. Whether it's musculoskeletal, is it their facet joints, is it their disc? They're all maybe degenerative. They all may have issues, but which one is causing it? Maybe it's all of them, right? So.
Mm. Yeah. And well, before we kind of get into like the nuance of like determining which and which, you had mentioned that that spine surgery really necessarily isn't dangerous, but I mean, there is some danger to it. And so when
Yeah.
you have someone going into surgery, you obviously have to explain, what you're doing, and, the dangers behind the surgery and so on. And would you classify spine surgery being dangerous? Does it depend on the surgery? Does it depend on the patient and so on? I guess, like, how would you, it's kind of a philosophy question too, just in the sense of like, you also don't want them to feel like this is going to be, this is going to, I feel like if you tell them early on, this is going to be really a challenging part moving forward, it may kind of like dampen their ability to recover in some instances. I don't know. Like, what are your thoughts on that, and like how you viewed like how dangerous spine surgery is?
Yeah, no, I think it's a fine line, right? 'Cause I don't think spine surgery is necessarily dangerous, right? I think that's the wrong word. I think that there are a lot of risks associated with, you know, operating around the spine, and it depends on the area where you operate on. The risk can be higher or lower, right? So in the low back, if you have a disc herniation and you need a micro discectomy, that risk is significantly lower than if you have spinal cord compression in the neck and you need that to be improved, right? So, the risk of correcting a, spinal deformity and going around and resecting some of their vertebral body has a much higher risk. So there's a graded of risk. I wouldn't say again, it's necessarily a dangerous surgery. I think that we have evolved significantly in our ways to keep surgery safe. We use, neuromonitoring in surgery for most of our cases, where we actually have a tech that's monitoring the nerves and the spinal cord the whole case, so they can tell me if we're manipulating the nerve root too much, or if we're close to the spinal cord, if we have signals that kind of start to diminish, especially when we're doing really important parts of the surgery, which would be like, either correcting a deformity and taking out some bone that's around the spinal cord, or maybe trying to remove a disc herniation or something like that. So I think that they need to be aware that of the risks. And I explain, what the most common risks are, the consequence of those risks, and then the chance that that risk happens, right? I think those are the kind of the important things people need to know, and they need to hear it in kind of more, I guess, layman's terms to understand what, this could happen, this could be the outcome, and this is the chance that it could happen. And I think that that's super important to going into surgery, is understanding the risks of, what you're undertaking, because any surgery has risk to complications. It doesn't make it a necessarily dangerous surgery. It just means that that's kind of the inherent part of doing surgery.